Hello, my name is Don Tatalovich. I'm the owner of Cornerstone Dental Center. And today I just want to talk a little bit about why sedation might be necessary for a patient undergoing an implant procedure. So, a couple of the things that initially would come to mind would be if somebody is undergoing a procedure where they have to have a surgical procedure done and maybe they have a little bit more anxiety when it comes to dental treatment, trying to help them remain as relaxed as possible so that the procedure is comfortable and like I said, as relaxed as we can maintain things for them. And then also in a situation where if the procedure might be a little bit longer in length, that will, through the duration of the appointment, allow them to stay comfortable. So at our office here at Cornerstone Dental, what might be some of the sedation options offered? And so here at our office, we offer nitrous oxide, or sometimes people will call that laughing gas. And then the other thing that we'll offer would be sometimes called oral sedation, where our office would call a prescription in and then the patient would bring that with him to the appointment in order to alleviate anxiety and keep the patient relaxed. If a patient chooses to undergo the procedure using sedation, how could this benefit the patient? And so generally when someone's very anxious, there's the perception that the appointment might be taking longer or might be more arduous. But if the patient is relaxed, kind of the opposite perception is usually occurring, where the patient is feeling like things are done a little bit more quickly and easily. And so on their end, that's kind of the perception. If we're able to keep you relaxed and comfortable, for us, that allows us to work as efficiently as possible also. So if I'm choosing to undergo a dental procedure and I'm going to use oral sedation, what does that look like and how does that process work for me as a patient? With oral sedation, that's something that will determine, based on health history and length of procedure, what's an appropriate sedative for you as a patient. And then that will be a prescription that we'll call in. And so we'll call that into your pharmacy. We'll discuss the expectations and the process for using that. And then we can make sure that patient or that individual is appropriately comfortable prior to starting our procedure. How do I determine if I'm somebody who might benefit from using oral sedation or nitrous oxide during a dental procedure? And so I think what I would evaluate as an individual, do I have a difficult time sitting through simple dental procedures such as maybe a cleaning or more straightforward filling? And so if that might be the case for me, if I'm very anxious going through those type of procedures, I think considering using either oral sedation or using a nitrous oxide for a procedure such as an implant or a crown or something like an extraction where, that might make me a little bit more anxious even. When we have an individual who's particularly anxious about dental treatment, this increases your stress and anxiety and can cause that appointment to either last longer or feel like it's lasting longer. So by reducing that anxiety and decreasing your stress with the situation, that's going to positively impact both the process of treatment as well as the post-operative healing process. I think one of the things that concerns me for patients would be if somebody is avoiding dental treatment that they need because of anxiety or because of fear. I think that's something that, as we have an opportunity to discuss that concern, please bring that up. And so don't overlook that or fail to talk about that with us. That's something that there are options to treat your anxiety so that we can figure out how to get the dental treatment completed that you need. That way, whatever issues you're having, we don't see those becoming more complicated or worse for you. If we're starting to consider replacing a tooth with an implant, or there's a dental procedure that you're suspecting you might need, but then also there's some anxiety surrounding that, please let us know. Please give us a call. If you're a new patient, you can bring that up right away as you're contacting us. If you're an established patient with us, it's not too late to start having that conversation, so that if we do need to consider using sedation methods to keep you relaxed and comfortable while we're completing treatment for you, let's not let that be the reason that you don't get the treatment that you need. I had a patient that he shared a story, some feedback on his treatment with sedation versus having received treatment in the past without sedation. And I just wanted to share that as well. So a patient that I was working with who he needed implants. He needed 4 implants placed to support his denture. That was a longer procedure for him. And so we discussed kind of the treatment plan with the implant placement. But we also discussed with the timeline of that and his anxiety, the need for some sedation. And so we were able to use some oral sedation for him, which kept him comfortable and relaxed throughout that procedure. And his feedback, that made the procedure a lot less intimidating, and he felt a lot more relaxed throughout that whole process. And so the outcome was for him much better because the experience seemed, again, much less intimidating.